Hi, my name is Carlos, and I'm a World and European Championship finalist in ballroom dancing, and I'm a professional dance teacher in San Francisco Bay Area.
And my name is Christine Matsumoto. I am also a ballroom dancer, and by trade I am a physical therapist and a dance performance coach, and I help dancers optimize their performance for their best physical capacity on the floor.
Cool. So today we wanted to talk about physical therapy and dancing and how that works together, how to prevent injuries, how to recover from injuries, and how to train better.
Let's get into it.
Cool. So why don't we start with our first topic, right? So injuries, and why do you as being professional, and know so much about the body, why do the injuries occur for ballroom dancers, and which maybe are the most common ones?
I think this is probably the trickiest question to answer, to be honest, because there are a lot of factors. And I would say they're separated into two categories. First are traumatic injuries, such as falls, a collision, slipping your foot, what have you, getting tripped on the floor, anything like that. So these are kind of out of your control for the most part, and it's a big part of our sport because we dance amongst other couples and dance couples that have different choreography that move differently on the floor. So I think that's one category, so unexpected traumatic injuries. But the second more common type of injury is what we call an overuse injury. So an overuse injury would be, that's a type of injury that's more what we call multifactorial, meaning there are many factors that contribute to an overuse injury. So that would be like overtraining, not getting enough sleep, pushing your body past its physical capacity too early or too soon. And I would say those are primarily the reasons why overuse injuries occur.
Yeah, definitely. I can see that in my students sometimes because they want to do good and they want to do better and they want to improve, and they want to put more effort into it, right? So then I feel sometimes that they are kind of trying too hard, So sometimes I feel that it's not required to put so much effort into this motion, like some kind of knee action, and they like try so hard, and would that be contributing probably to overusage, right?
I think that's certainly a possibility. When injuries occur, it's usually because the physical ability of the tissue, like what you're asking your body to do, and then what your body's actually capable of doing is mismatched.
Yeah.
And to be honest, sometimes it's really hard to tell where that line is. The key is when you're training, and this is appropriate for like any type of physical activity, including dancing. You just want to make sure that the progression is gradual. And that's how we at least reduce the risk of overuse injuries occurring.
Yeah, definitely. So I think this kind of ties into why in ballroom dancing we have these levels, right? We have the bronze level, we have the silver level, we have the gold level, and then we have the open gold, right? Because of course everybody wants to go to the open gold level and do the fancy figures, but what sometimes tends to happen is that the body is not ready, right? So, and then you just probably overly strain yourself and risk a little bit of injury. Would that be the case?
Yeah, I agree. I think when the progression is too steep, then the risk of injury is higher. And especially when you're talking about higher level choreography that involves syncopation, so faster timing, that involves more force on the body with rotations. Like your body actually has to train gradually to be able to like accept and manipulate these forces and not just sustain them. And when students of like all levels, when they either try more complex choreography or overtraining is also a very common reason why injuries occur. So they're not taking appropriate rest days, or they're traveling a lot, which a lot of our amateurs and professional dancers do. They're not getting adequate rest. Like all of these factors can contribute. But yes, complex choreography can be one possibility as to why injuries could occur.
Yeah. So, like sometimes, let's say if we move a bit more here and kind of have some example of that, right? Sometimes, and you can kind of, comment on that as a physical therapist, sometimes I see my students, they are not entirely sure how to use their like joints properly. I mean, they're sure, but like to fulfill the swing action or sway action or any type of figure, And then maybe you can clarify about the hip joint, you know, because like in my understanding and how my coaches were training me, they always tell me that, you know, hip's supposed to, you know, bend there, right? And then knee's supposed to go forward, you know, and then the ankle flexes, right? And sometimes I feel just that sometimes one of these joints they're not aware that what to do with them, right? So they would kind of, maybe the knee is kind of going a bit too much there, or because some parts of the, I don't know, the quad or the hamstring maybe are not as strong, you know, and then they sometimes kind of do something like that, you know, and it kind of ties into that, I guess we go back to that level sort of, you know, gradation of dancing, because when you have this simpler figure, you know, you can kind of get away a little bit bending, you know, a little bit flexing here and kind of moving, right? But once you get into the harder one, you know, you need to really get around each other. And then I feel people sometimes, I don't know, do this, you know, kind of like do this with their hip, which, you know, it really complicates things when you try to do it together, right? So what do you think is like the basic good feel about how to use your legs, you know?
Yeah, I think that's a great question. So like as a dance student myself, that's kind of the information that I've been given from all of my teachers, which is you have a little bit of bend in your hip. This will naturally bend your knee. And then say you're traveling forwards, which most, like anytime you're moving backwards, you want to make sure that this flexes first, the knee comes forward, and then you transfer the weight. Yeah, and I think that's actually exactly what you said. So I would agree with that from like a dance technique standpoint. From a biomechanical standpoint, the hip primarily goes this direction, right? The hip has a little bit of range this way, but not that much. So in order to like generate action of like pushing the floor backwards, the hip really has to flex backwards. So from a biomechanical standpoint, I would also agree with that. And then secondly, the hip and the knee are connected by a common bone. So what a common saying that we have is the bottom of one joint is the top of the other joint, meaning the bottom of your hip already starts at your knee. So whatever your hip does, your knee will also do, and vice versa. So maybe I think,
let's step a bit back here. So that's maybe going to be better.
Yeah. So I think that dancing is a little bit tricky because the movement is never one direction. There's a component of rotation. So that's where it gets a little bit complicated. We're not just moving backwards. We're moving backwards with a rotation. So then, of course, your dance teachers will tell you like, oh, make sure you know who's on the inside, who's on the outside of the turn. And that's where I think things get a little bit tricky is
with the torque, with the rotation.
Yes, exactly. And then the orientation of the individuals changes as we move.
As we commence through a
Correct.
figure, right? So let's say we would start some kind of super simple step. As a beginners, we would do like a box step. It's kind of more one-dimensional, right? It's just back and just side. When you kind of start to get more fancy and advanced, right, we start to incorporate rotation into movement, so we start to engage our bodies differently, right?
Exactly.
So that makes sense. So I think I was kind of thinking about it, and it's kind of like when I go to gym, right, or whatever, run, I feel like most of the things that we do as humans are one-dimensional, right? Like running is sort of just straight.
Yes.
Or, I don't know, you do a squat, it's sort of like that.
Yes.
Right? But in the dancing, right, what's going to happen? You're not going to be doing this, right? You're going to kind of start like this, and then kind of turn and finish like that. So I'm guessing that biomechanically it engages or requires other parts of body to engage and stabilize you throughout a movement.
Yeah, I think that's a great way of putting it, yeah. So let's say in the biomechanical world, we know like this motion front to back is what we call sagittal plane. This is where we spend a good amount of our time, yeah. And then we also have our frontal plane, and this is, if you want to think of it in dance terms, this is your sway, correct, exactly. So it's if you were like in front of like a wall or like a glass window or what have you, it's this direction. Yeah. And then our final plane is transverse. So this goes like parallel to the floor. Yeah. So in dancing, we use all three planes. Yeah. Versus something like running or cycling, primarily the more sagittal plane you are, the better. Yeah. But in dancing, we have to that's what's so cool about dancing is we use all three planes. And then these two bodies are harmonizing together and then moving like through space. That's why it's so interesting to look at. And that's why people, you know, dedicate their lives to being better dancers.
Yeah. Because I'm guessing, you know, like for example, like I have these rings at home, you know. For example, when you do a push-up just on the wall, on the floor, right? So it's a sort of a fixed situation.
Correct.
Right? So you do that, right? As
Yes.
soon as you, let's say, you put the rings and then you kind of let them drop, and now they're sort of hanging
They're
in there.
moving, yes.
So now you must not just use your muscles for the push-up itself, but you also need to have the stabilizing, whichever muscles do that, to, you know, first stabilize, then use. And I'm thinking kind of like, let's say dancing is kind of the same, right?
Yes.
Because it wouldn't be just a squat, okay, just stable and, you know, just squat, right? Let's say you do a Venus waltz or natural turn, you would also have the turn. So now you must keep, let's say, the knee, right? Sort of in some kind of certain position, right? Preferably probably over your ankle and over your foot,
Yeah,
right?
yeah.
So you can't allow it to do whatever you want.
Yeah.
Right?
Yeah.
So I'm thinking, like you mentioned, the transverse, right? This one
Yes.
was the transverse. And, you know, and then you move your body from foot to foot. You start to need not just the power, but also stabilization, right? And I think sometimes, I don't know, correct me if I'm wrong, but that's where the injuries come from, because we overload like a weaker part of the body. Like, I don't know, you know how these, I don't know, what do you call those, ligaments over the knee and all those ones, right? They're not really designed probably to keep load, right? They're kind of designed for stabilization. And you know what I'm trying to say?
Yeah, I think you bring up like several interesting points. Again, injuries I think it's kind of a complex topic, but I would say for, let's say, muscle strains and ligaments or sprains, like if you were to sprain your ankle or overstretch your ligament, either it is a like quick movement that provides like a quick stretch, which either partially tears or just like interrupts the tissue, and that creates inflammation.
Could be a fall or some kind of jerky movement.
Exactly,
right?
yeah. Usually there's this kind of faster action that the tissue is just not prepared for. Whether that's with repetitively doing the same movement over and over again without resting, or it's this quick unexpected movement. Yeah. And it's kind of a tricky topic to break down, but I do think there are components of what you said there that are true, absolutely. Like forcing your body into certain directions, I think for males, but maybe a little bit more for females, or like those dancing in like the follows position, like adding more shape and really getting, let's say, to the outside of the dance partnership, that will create way more like physical force when you're doing rotations. So very commonly for dancers, like neck and back injuries are two of the areas that are most susceptible to injuries. Yeah.
So, for example, you know, if we would do, sometimes when I'm teaching, I'm struggling with students because they all want to do like the most shape humanly possible, you know? So then we would kind of, let's say we have the frame, right? And we go into the throwaway, right? So now, in this situation, what do you think is like appropriate? Now I'm shaping you, and like how to know that, you know, you're doing too much or not, right? Because sometimes in this position, right, they would start to shape, and they would start to maybe lose the balance, you know?
Right. Yeah.
And, you know, my kind of philosophy is, okay, first feel stable, you know, kind of
Absolutely.
a balanced, so you can control it by yourself, right? And then I'm going to enhance it, whatever, 20% more, 20%, 30, 40, or whatever it is. And sometimes I feel that they stretch so hard. And, you know, that's probably could be also a cause of possible injury or overuse, right?
Yeah, if you do it over like multiple times and you're not giving your body adequate rest in between, especially those of your students who are competitors, there's like this added stress of the competition itself, which kind of like heightens our like our physical hormones, but also like our emotional stress and our cortisol. So in this particular case, and line figures are very common because usually they involve like a lot of extension.
Yeah.
And when you look at the history from, let's say, ballroom dancing when it first began, where people were dancing like face to face with their hands like just like this,
very kind of
right?
relaxed.
Yes, exactly. Even with like the elbows more relaxed, And then now dancing has really like transformed into like something that creates quite a bit more dancing has transformed into
More volume.
more volume, more athleticism is actually required, right? And I think, in going back to your question about like the throwaway oversway or any type of line figure, from a maybe like dance instruction standpoint, when I was a student, my teacher would always tell me like, in any type of line figure, you have to be balanced, like on your own foot. So you're not like relying on your partner to hold you up. This is already going to be problematic.
Yeah.
It's going to be harder for you, and I'm not doing the work that I need to keep us stable.
Sorry, and I'm thinking, my question was, okay, for you, right, as a female or a
Yeah,
follower dancer,
yeah.
like, okay, I'm overdoing it, right? Possibly or possibly not, and then we kind of discussed it. But then I'm starting thinking, when you do more, like that also affects the partner.
Yep,
right?
absolutely.
Because for me, I'm sort of expecting, you're going to be balanced.
Right.
And then you start to go somewhere where I can't follow.
Yeah.
Right? So that might cause, a strain in my body.
Yes,
Right?
yeah,
So I think
yeah.
that's also another interesting aspect of ballroom dancing, because we are so together, and we are so kind of a co-relying on each other.
We're moving with another person, totally.
So I think that we should kind of take that into consideration, right? Especially when learning, and always, I think, not go too far beyond the max, right? Because when you go beyond the max, not necessarily I can follow you there.
That's very
or maybe
true.
I don't know how to follow there you yet, right? So we kind of think that's why I wanted to talk about these injuries and, just from body's point of view, how to not overdo it,
Yeah, I think this definitely goes back to the recommendation of like a slow, gradual progression. So like in ballroom dancing, we're moving with another person. So what we do influences another person, which is great because you can leverage that to create like beautiful movements and shapes. And on the other hand, it can be detrimental because what you do could negatively affect your partner, right? So like in going back to this example of a throwaway oversway, like the way I was taught as a dance student is like, as you're extending your top, you're not only relying on just this movement, you're making sure you're creating opposition, right? So you're always balancing. If you're getting more here, you're going more here. Like you're using your leg, your floor to support that.
Yeah.
And then the more you go with your top, the more you have to work on your base. And in the case of line figures, I think this is one kind of challenging part because visually we see what it looks like. And it looks big and full and everyone's doing these kind of grand extensions. But what's covered by the skirt,
You don't see it.
you don't see what they're doing.
The magic.
Which is really how they're coordinating their lower body to support their upper body.
Yeah.
Yeah, but the partnership aspect is really crucial because what your partner does, it will affect you, and it can be positive and it can be negative.
Yeah.
Yeah.
Let's go back there.
Yeah.
So, check that. So, question we just talked about, what came to my mind, sometimes we talk about stretch, extension, right? So it's such a small thing, but sometimes I feel, especially in the beginning when you're learning and if you didn't have a lot of experience in dancing or in other like a performance sports,
Right.
I guess in running you don't need to stretch, right? You just run, right? There's not much things to think about, But in dancing, right, we want to have this stretch and extension, right? And some people kind of get it more instinctively and they get the good feel. And some people kind of, they would compensate, like, I don't go there, or like they
here.
stretch, or they just move. They just move. But let's say moving your body from this position to this position is not really a stretch, right?
Yeah.
I think they see the picture from the videos of the
Right.
professionals dancing
Right.
and they see, okay, so the woman's head was there and now it's there.
Yeah.
Okay, so that's equals stretch, right?
Yeah.
So they would kind of be here and then they're there, right? But that would just make them kind of tip over, So I was just thinking from, let's say, from physical therapy's point of view and just biomechanics, like what is a stretch?
Oh, that's also a great question. So from a basic definition, like a scientific definition of like a muscular stretch. That's kind of what we're talking about. In order to have a stretch, one side needs to be fixed and then the other side needs to be moving.
Moved, right?
Yeah. So that there's like there's a change in length of the tissue, whether it be
muscle fiber.
Yes, whether it be
ligament.
temporary or whether it be permanent, especially if you like do some stretching over time.
Yeah.
There are various types of stretching and two primary types, static versus dynamic. Okay. Static stretch is what you would kind of do if you're like holding a position for a period of time, so you're not moving. A dynamic stretch is a faster movement where you basically kind of like
a stride.
Yeah, you like quick stretch. Yeah, as opposed to like a prolonged stretch. Hence the word static. I would even say you can create a stretch in a tissue by moving both points, but yes,
away from each other.
Yes, no? Either I would say one side remaining fixed, one side moving away, but also both sides going in the same direction, but one side moving faster. So then that will also create elongation of the tissue. On the other hand, from like a dance instruction, dance technique standpoint, I think the word stretch gets used a lot.
For different things.
For maybe. A lot of different things, yeah. And to be fair, it is an appropriate term, but it can mean a lot. Like we see like, does stretch mean like increasing like your vertical length? Maybe there's a component of that. Does stretch mean like, is that's the thing that we see the most, but there's also this opposition of like pressure downwards in order to create the like visual appearance up top.
So then it kind of satisfies your criteria, right? Because you feel pressure downwards would be that sort of a direction.
Correct.
And stretch would create the difference, right?
Exactly. Yeah. So moving a little bit more in opposition. Yeah.
Yeah. Because, yeah, I think that's a great point. And then like what I was thinking about when you were talking, that it's kind of like with any kind of stretch of your body, right? It's sort of probably a long-term project, right? You wouldn't want to jump into a split today if you can't do it, right? Because what's going to happen to you? You're probably going to injure yourself, right? Because your fibers are not ready to take up that position.
Yeah,
right?
Yeah, absolutely.
So you should probably teach yourself slowly, whichever body part you want to stretch. You know, you don't want to have this stretch. You need to, teach your body and, kind of, take it slowly. Right?
Yeah, and again, we're kind of coming back to the same principle of like progression over time, like gradual progression. And this is not just for dancing, this is any type of, let's say, physical skill, right? Like when you learn to write as a kid, you start with like very basic ABCs. You start with like how to hold the pencil or pen, right? And then as you practice more and as you age and develop, then your writing becomes more smooth or more clear, or then you start writing cursive. But you don't start with cursive in the beginning. This is a very simplistic example, but I think it illustrates like why it's important to kind of train your body from the ground up and then just gradually improve over time.
Yeah, I think it's definitely. Because we all want to get to the end point of beautiful open goal dancing with amazing routines and all of that. But I think it's kind of like the story with the rabbit and the turtle, right?
Yes.
When the turtle just keeps on going, just slowly, and the rabbit kind of jumps and then stops, and then and he's so quick. But sometimes the turtle wins because it's just a gradual compounding efforts into the direction you want to take, and that ultimately gives you the result, right? And sometimes I feel like people, they do the shape, but they can't sustain it, or they do the big movement, but it's like one time, and I feel like in the long run, they actually not learning as quickly as they could, if they would just slowly progress, right?
Yeah, so kind of what we're talking about now is learning what in like the biomechanic world is a psychomotor skill, meaning you're like training your body to do a physical action. Yeah, like take weightlifting for example. Weightlifting is probably the most opposite to dancing that you could
Do.
that you could probably like compare like these two things, but they have the same principle of you have to start with 1 pound or like some smaller weight, and then you gradually build over time.
Yeah.
I think weight training is a little bit more straightforward in a way, because you'll know if you're getting better if you can push more weight or if you can move more weight. 5 pounds to 10 pounds, 10 pounds to 20, etc.
But I think what I wanted to say here is sometimes, of course, the weight is important, but what about form?
That's very
Right?
true. Yeah.
So then, I would go to gym and I would see all these people, they're pushing like lots of weight, but like that, or they would, kind of do it like this and then like that.
Yes.
So then what's really the point, right? I'm thinking.
Absolutely.
Then
Absolutely.
Sometimes I feel just the body-mind connection, I'm thinking, okay, I'm doing this exercise and it's meant for this muscle and I want to have a good core, right? Because you're going to train your body to be like that.
Yes.
So, and then in dancing the same. Yeah, you have a big step, but you train your body to be like that.
Yeah,
right?
yeah.
Wouldn't you be better to have a nice form? Yeah, I can't do the big step, but I can do this. And someday can do better, right?
Yeah, absolutely. That's very consistent with how I was taught from all of my previous dance teachers. The tricky part with dancing, and I think this is separate to weight training, is like assuming the form is good, it's kind of hard to determine if you're improving with dancing. Like there's no real objective
measurement
feedback. You could even say like making finals or like beating couples that you didn't beat before. Like you could say that is a measure of progress, but even that is subjective. In weight training, again, assuming the form is good, if you're improving if the dumbbell that you're carrying or the weight on your back is higher. Yeah. So I think in dancing, it's a little bit more challenging to grade your progress. Because even with these levels of dance figures, yes, those figures are more complex, but that goes back to like, how do we know our students are ready for that? Or how do we know just because you can do it, can you do it well with good form, right? Can you do it in a way that optimizes how your partner moves and doesn't kind of negatively affect them, right?
I like, because of this subjective component, I think like dancing is sort of like a language, right? So it's in a similar way, from month to month, if you're learning Spanish, English, or Russian, or Latvian, or whatever, or I don't know, German, right?
Yeah.
So you would probably, how would you tell if you are better at German? It's kind of the same thing. You know more words, but you don't know how to use them, for example.
Right.
Or kind of like a Nobel Prize in literature, right? It's not just how many words you use, but how you combine them and how you express yourself or your work of art through this language, and you create this, either it's a poetry or a book or some kind of literature work, right? Is a language. So you need to have the vocabulary, but you need to know how to use them.
Yes.
You combine them, and then and then the languages are different. The way how your body speaks or my body speaks is different.
Yeah.
Right. So if you make a Nobel Prize winning, whatever poem in German, it's going to be very different than poem in Italian or Swedish or English, and maybe you can't even translate that. But it's just so. How to get better, right? So I'm thinking kind of like only retrospectively you can say, oh, I know more moves, I have more skills,
right?
I have more, capability to express myself into the music with my partner, and I can look back and wow, this is a nice work I've created, because sure, you beat somebody, but that necessarily means that you're better. Maybe, you know what I'm saying? And maybe that's the way how to grade yourself, right?
Yeah, and I think that this is kind of the unique aspect of all aesthetic physical sports, right? There's a component of how your body moves well, whether or not you can do that. But then there are also these intangible qualities, like how it looks when your body moves, like whether or not you can interpret the music in a way that other people can understand, like your body language, for example. And as much as we like train the technique, the physical movement of our body, I think this is where like dance teachers can and do support our community when we're thinking about bringing up the next generation of dancers, is like teaching them those intangible qualities of dancing. It's hard to put your finger on it, but you know it when you see it. And you know it when one couple is doing it, when the other couple is not. Even though physically they may be dancing the same thing. And that's what always keeps me coming back to dancing, is just those like intangible like moments and qualities and of movement that you can bring on the floor with another partner. I think that's the coolest thing of what we do.
No, definitely. So why don't we circle back to the beginning of the injuries, right, and how to prevent them? And let's say now, okay, you've injured yourself, so what to do?
Yes. Okay. So when I think the most important question is when to seek professional help, because sometimes, to be honest, it's not necessary. If you have an acute injury, let's just say very basic, it's also very common, an ankle sprain. Yeah, it happens quickly. You stretch your ankle, immediately maybe it becomes kind of painful to walk. It becomes a little bit swollen, warm, and you have to hold off on dancing for a few days. So I would say that would be the acute stage. So if it's a traumatic injury, the acute stage is anywhere from the time of the injury, let's say, to roughly 2 weeks, roughly. Yeah, assuming this is like a non-surgical situation. Exactly. Yeah. So in that acute phase, the most important things to do are to ease off the activities that are bothering it. One of which could be prolonged standing, or dancing for several hours, or maybe specific movements of the ankle that are a bit uncomfortable. So dialing down the triggers of the symptoms and then dialing up recovery strategies, which would be decreasing a bit of your physical activity, maybe adding some compression. Ice is very common, or cryotherapy for acute injuries. Anything that helps to reduce a little bit of the inflammation, gets you feeling better. Maybe some like over-the-counter pain medication, or some non-pharmaceutical ways of pain relief, of which there are many now. Yeah. As we're moving into like the subacute stage, which...
What's that mean?
Subacute, we say, or we define in the rehab world as roughly 2 weeks to what could be 2 months.
So you kind of recover, but not fully, right? You're not recovered. You just got it. It's not acute pain anymore. It's kind of annoying.
Exactly. So you're kind of in that period of time where maybe you're not completely symptom-free, but you can walk a little bit longer, you can stand on it longer, maybe you can dance a little bit. It doesn't look swollen anymore, it doesn't feel warm anymore, but you're still not at the stage where you can dance rounds or you're back to 100%. Yeah. In this stage, what we recommend is light, gradual, again, progressive loading. So doing what your body is capable of doing, but doing so in kind of like small chunks. So you're not pushing past, again, what your body's physically capable to do. Yeah. So in this stage, what we would say is, okay, if you want to get back to dancing, let's see how much time you can be on your feet. Yeah. So if you can only do an hour, you want to stay maybe a little bit underneath that. So don't kind of push to the full hour, maybe go for 45 minutes. Yeah. And then
don't want to make it worse, right?
Exactly. So even though we're kind of trying to get you back to a gradual, like full performance in this case, pushing too early can unfortunately set you back. In this stage, I think it's also really important that if it's a serious enough injury, you're seeking professional help, which would be, like in this case, could be a licensed physical therapist that can help to assess the injury, where the deficiencies are, which could be power, flexibility, etc. Any components that you would need for your for getting you back to 100%, and then formulating a plan of either manual therapy treatment, which would be done by, say, myself, or a licensed practitioner, and a program of gradual strengthening, stretching, flexibility, like any exercise that can help to get you back. Yeah. And then hopefully after the acute stage, we've gotten you to a point where you can gradually build up to full performance.
Okay, that's very helpful. So why don't we talk a little bit about strategies for recovery?
Yeah, I think this is a topic that not too many people discuss because it doesn't look very fancy from the outside. But the most important thing about recovery is that it can maximize and enhance your performance. That's what people need to know about, is if you are employing certain strategies to help to decrease the inflammation in your body, down-regulate your sympathetic nervous system, like anything that helps to improve your ability for your tissues to recover faster, then you can perform better earlier. That's what's super important. But people don't discuss it because it's not a super fancy topic.
That is exciting.
And
right?
it's not super exciting, yeah. But I would say certain strategies for recovery and when to utilize these strategies for recovery are two really important topics to enhance your performance. Yeah. So what is a recovery strategy? It could be a lot of things. It could be getting appropriate rest. I think this is super important for anyone who does like high intensity interval training, which is, as competitors, what we do. We go anywhere from 1 minute 5 to 2 minutes times 3 to 5 dances over multiple rounds. Like if you look at, there are only a few like scientific research articles on dance sport or ballroom dancing, but of the ones that look at energy expenditure, we are hitting pretty high heart rates from probably our second dance onwards. So like if you look at waltz is about like, depending on your choreography, could be like 40 to 70% of what is your maximal heart rate. And for those of you who are less, just less aware of why heart rate in training is important, is the higher your heart rate is, the harder it will be. That's it. Yeah. And then as we age, but also as we train, we can push the envelope of how long we can sustain a high heart rate. And in dancing, that is a big part of what we do, is who can last longer and look better.
Makes sense.
So even when you're watching the final and then quick step or jive, or like whatever is the last dance, right? It's no coincidence that one of the fastest dances is at the very end, and you watch the final, and everyone is pushing to the max. But who can sustain that physical high intensity and look better doing it for longer? Those are the people that win the last dance, at least.
So how to get better at it?
Yeah. So the recovery strategies happen actually after the competition or after rounds. So the first one I mentioned is make sure you're getting decent rest. Okay. Make sure you're getting decent rest.
Yep.
And for those who travel, go to international competitions, like if you can, give yourself a couple days to accommodate to the new time zone. Or you can also like set your circadian rhythm before you travel. So by the time you get to your destination, you're ready to go. And there are scientists that have actually have proven strategies to help to change like when you sleep and when you wake up, so that you're set to be in the next time zone by the time you get there. So the first one is like adequate rest, before and after a competition. After rounds and after a competition, you want to try to work on like certain breathing strategies to help to get your heart rate down. And this is really important because as we're pushing our body into those higher intensity zones, anywhere from like, I would say 70% of your heart rate max and above, which is all of dancing, you want to make sure you're giving yourself a period of time where you're working on slow exhales, deep breathing, and it could be as quickly as 5 minutes, but this really helps to down-regulate your sympathetic nervous system, which is the primary driver and a response to all this high-intensity exercise you're doing. So with high-intensity exercise, not only are you working your physical body to the maximum, but you're also creating this physiologic process that takes like several days for your body to recover. Some people recover faster than others, that's true, but as your body matures, that recovery time takes longer. So anything that you can do to shorten that recovery time will further optimize your performance. So say in the context of international championships just happened, right? So they have qualifying rounds, and then they have for those that advance, right, they will dance at Royal Albert Hall, right? So you're dancing potentially multiple days, right? So if you are utilizing these recovery strategies after you do your first few rounds, your performance can be improved for when you dance at like the top 48 or whatever the rounds are at Royal Albert Hall. So getting adequate rest, deep breathing, focusing on exhalation. And then some people also like to utilize various strategies of like sauna or cryotherapy. So those of you who take like ice baths, that can really help to reduce inflammation and aid in performance. So like Derek Huff, who was a previous like youth championship and kind of was brought up in the dance world and has since been like a judge on Dancing with the Stars, but look, very accredited choreographer. He just finished his tour last year with his wife, and at every show, which is a show of maybe 60 to 90 minutes, he's doing an ice bath because he needs to do the same thing the next day for the next 4 days. So that's another strategy that can be helpful.
Okay, cool. So we talk about this recovery, right? And then the maximum heart rate and warm up. So, you know, like, let's say from biomechanical point of view, like, what do you think is optimal to push yourself, you know, in zone 4, push yourself into this high intensity place, you know? Because I think sometimes it's very prevalent, oh, you know, big comp is coming up, okay, everyday rounds, you know?
Yeah.
Would you think that is wise?
So this, I might be disagreeing with some very prominent dance instructors and adjudicators by saying this, but I will say it. I think dance camps before a competition, I don't know if they're really the best thing to do because dance camps will hold rounds, right? And depending on when those rounds are held to when the competition is, if there are not enough days of like rest and recovery before, this can actually limit your performance. Yeah, your physical performance. I'm not saying maybe the competition results aside, right? Keep in mind that when you're doing rounds and when maybe I'll talk about rounds first, so there's no competitive like stress in the environment, let's put it that way. When you're doing rounds, you're really pushing yourself into these higher heart rate zones. So it really is important that you're taking some time away where you're training at a lower intensity afterwards. It could be, for some people, maybe they just need 1 day. For other people, maybe they need up to 3 days. I'm sure if you talk with like the older slightly older, like professional or amateur dancers that have been competing for a while, they will tell you that it takes longer for them to recover back to where they feel like their body can perform at their best after rounds. Let's say when we're youth or maybe even under 21 dancers, the recovery time is just shorter. So you could probably do back-to-back days and feel all right. But as you become more of a seasoned competitor and as you compete for longer, that will most likely change. So higher intensity days, which are for sure rounds days, like you can maybe still participate in rounds, but maybe not go for the full length of time, or maybe don't do as many rounds. I've done, just speaking from my own experience, I've done rounds of just two rounds, and then I've done rounds of 4. And then the next day I wake up, I do feel different. 4 rounds versus 2.
I guess it probably depends on your fitness level leading up to it, right? If you're like, on a lower level and then you suddenly are required to do this, it's going to be such a huge strain, probably not wise, right? But when maybe you're higher level, maybe, you go into this couple days, or I don't know, couple days probably in this situation, then it's maybe more sustainable, right? Depends where you expect your peak to be, right? Because obviously if you push so hard, then probably, you want to have a little recovery and then you're ready to push higher, right? Probably you wouldn't expect to do like 4 rounds, on Tuesday, 4 rounds on Wednesday, 4 rounds on Thursday, and on Friday have your best dancing ever, right? You would probably be super exhausted. I guess it could play a role of just, kind of like building up your mental fortitude and sort of endure it, right? So when you endure it, you feel like next time you do it,
you can go for longer.
Yeah, you did 4 rounds and now you need to just do 1. It's like, oh wow, that's easy, right? Because I remember from my training, we would do maybe, I don't remember how many, but we would do a couple of rounds, and then sometimes we would do like a very long dance, like you do waltz for, I don't know, like 2.5 minutes, which is hard, it's, I don't know, depending again on your fitness level and your capability, right?
This is also going back to what we talked about earlier about injuries, overtraining and stress. Those are 2 components that can contribute to the increased risk of developing injuries. So when, let's say, a competition is coming up, sometimes people will try to squeeze in more practices or do more rounds or what have you. That is actually probably the worst time to front load your training, because now you're changing your, let's say, practice structure or your amount of physical activity right before an event that will really require not just like physical and like mental fortitude, but will be quite demanding and quite taxing on your body. And then from the competition aspect of things, you have like the lights, you have maybe your coach there kind of giving you some feedback, different costume, audience members, like all of these additional components that will rev up your sympathetic nervous system.
Additional stressors, right?
Increase your cortisol, increase your adrenaline, all of which can be helpful if you know how to funnel it, but it can also be detrimental and increase your risk of injuries, especially if you're training more right before the competition.
Yeah, right. Because I'm thinking, I'm preparing for this, endurance race.
Yes.
And right, and exactly what you talked about, right? I acquired this training plan, which goes on for like 6 months, right? And then every week there would be a certain amount of training minutes sort of allocated for different disciplines, and it would kind of start slowly. And then you would kind of push for 3 weeks, like a little bit more, a little bit more, a little bit more. And then the 4th week is a sort of recovery week.
Yeah.
Hours go down, intensity goes down. Most of the running or cycling or swimming is kind of zone 2, which is kind of like very slow, just kind of, kind of jog a bit or whatever, just cycle very slowly.
Right.
And then it kind of picks up. And then again, a little bit higher, a little bit higher, a little bit higher. And then it kind of drops again. So give your body like a week of recovery, right? And then, and majority of the training is actually sort of in this low zone mode, right? Which I think sometimes in dancing we don't or maybe people do it, but maybe I'm not aware of it, or we don't have this approach. Like you say sometimes, oh, it's a competition, so we'll have like a massive camp in the beginning.
Right.
We're going to tire ourselves out, and then it's the comp, right? Or we are preparing for some kind of competition. Okay, last week, come on, let's push it.
Yes.
And then, it's like you said, you push, and then you get tired, right? Maybe you should have been building up to it slowly, right? And kind of, introduce these rounds once a week or maybe every 2 weeks. Slowly, and then the last week is just sort of kind of like, dot the I's and,
Exactly.
cross the T's.
There's probably not
easy.
much you can really change fundamentally in the last few days before a competition. Like, because as you said, and as we talked about earlier, like the training aspect takes time. So you will not make these changes that quickly. And really the worst time to do more is right before a competition. Yeah. And I think this is what contributes to like, I mean, in any discipline, but this contributes to like people leaving dancing and not dancing anymore, right? Because they're doing so much for so long, you can't sustain that. So in like other forms of sports, like training for an Ironman or triathlon, for example, in the training world, there is a term called periodization, which means that there is a specific range of when you train at a higher intensity, and then there are specific times where you have like a deload week or where you calm down and just do less training, less physically intensive training. Yeah. And in dancing, I don't know if we really have something like this. Yeah, we don't have cycles. We know when competitions are. So in a way, if you understand periodization, you can be pretty strategic about making that work for your own practice. But I think this is a very common training principle in weightlifting, in endurance-based sports, in team sports, basketball, soccer. But I don't think it's that well known or well utilized at all in, I'd say, the overall dance community.
Yeah, maybe kind of let's move here a little bit more towards the table. Because I'm thinking now, kind of like looking back and, maybe helping some other young dancers or mature dancers or any dancers, right, to get better, thinking about how I feel, because I'm not super good swimmer, so I feel like much more comfortable in running and cycling. So swimming is harder to me. So, but then, over time, like you just talked about this periodization and kind of structuring, right? I just kept on doing it, and mostly zone 2, kind of focus on my technique. Don't really push too hard. Just kind of do it, twice a week, 3 times a week, just over 3, 4, 5, 6 months. Now I feel like my body has adjusted. My body has learned these movements much better. I feel like before I was like sinking and then, water in mouth and all these additional stressors, right? And now I'm feeling, okay, my movements are kind of getting better. Not that I have done anything differently. I just took time. I allowed my body to learn, and I did it all in zone 2, I'm thinking, maybe that's something we can do in dancing as well, right? Yeah, maybe you dance a round, but it's a zone 2 round, where you don't really push for the maximum, movement, maximum shape, maximum speed, kind of like max out all categories, Because if I'm thinking like for my triathlon training, it's never, that happens only on race day, okay, now maximum heart rate, maximum speed, go for it, right?
Right.
Usually it's just one objective. Okay, today, zone 2, objective, just, keep your heart rate actually as low as possible for maybe an hour, maybe 2 hours, right? Okay, just one objective. Then other days we have, okay, speed training. First of all, it's a higher intensity, so it's shorter. It's
exactly.
Never more than an hour, usually less. So, okay, you push for 5 minutes, you rest for 2. You push for 4 minutes, you rest for 2, right? And I'm thinking in dancing, it would probably also might be beneficial. Okay, you do a round, but it's zone 2. So you don't really move that much, You don't really shape that hard. You don't really, do it so much, because remembering myself and my training, it's like every time we do a round, it's got to have maximum, right?
Yes, absolutely.
Which is probably not the smartest thing to do, right? You constantly have these peaks and then you're going to crash, right? So you need to have this gradual thing, because for the long run, it's kind of like this thing, right? I like this idea, Like if you want to do really, really good today, and you have these bricks and you want to build as high as possible building in 1 hour, you're probably going to start stacking bricks like that, or whatever, 10 minutes, right? Things like that. So then it's very shaky, but in 10 minutes you can build high. But let's say if they give you a month, you're not going to do that, right? You're going to start to
You have
lay
time,
bricks
yep.
like that, right? You're going to lay them like that, and then as wide as possible, right? As much time and easy and slow. So now you can build a huge house, right? I'm thinking the same should apply for dancing, right? So we should have a lot of these very easy trainings, right? To build this huge base of comfort, of understanding, of stability, of ease, you know? What do you think, like from biomechanical point of view?
Yeah, I think what's great about our conversation today is we're taking two very different physical activities, right? You're taking a triathlon training program, and you're comparing that to ballroom dancing, right? When you look at endurance-based sports, the key is not like, you're not talking about sprinting, right? You're not getting like the fastest time in like a short for a short distance. You're talking about like several hours of continuous physical activity, doing multiple activities, right? Of course, some triathlons are shorter, some are longer, but you're going for a significant amount of time, right? So you don't want to max out on your swim, or you don't want to max out on whatever's like the first or second event, because you won't have any energy for your run, which I believe is the last event.
Yeah,
is that correct?
is.
Yeah. So if you max out your first two events, you have no energy left. That's not going to work out, right? In dancing, that's a great comparison to like dancing, in the sense that dancing is structured with these like strong peaks of high intensity, and then potentially minimal activity for a few minutes, could be a few hours, could be a few days. You could dance one round and then nothing for a few days, and then dance the next qualifying round like 3 days later.
Yeah.
Or if you're let's say at NDCA Dance Nationals, like your event could be on the same day, but there could be 40 minutes in between your next round, an hour in between your next round, right? So it looks very different,
Jarring, right?
I
It's
would
like
say.
high intensity and
then nothing. Yes, exactly. Versus with triathlon training, it's like, for the most part, pretty steady. The more steady that you can go and maintain your energy usage, the better, because the better time you'll get at the end, and then the higher chance you'll finish, right? Because you're going for several hours continuously, right? So I think these are great activities to compare. And what I would say with that is, I think there's a place for high intensity training, and there should also be a place for lower intensity training. The disadvantage to only training higher intensity is that it does take a toll on your body. It does take time for your tissues to recover, because your heart rate is at such a high such a high level that physiologically takes a toll on your physical body, and it does take time to get back to be able to do higher intensity training. If you train at a low intensity, you can train at a low intensity the next day, and the next day after that. In dancing, of course, it's necessary, because it's how we are judged. If you never train how we're judged, you'll never be able to dance that quick step for 2 minutes. You never train it, you won't be able to do it. But the recommendation, at least that I would have for our dancers, is be really strategic about when you are training those high intensity rounds, how many days before a competition, and then consider lengthening the time that you start those high intensity rounds so your body can adapt over time.
Yeah, that makes total sense. Because I was thinking, from the biomechanical point of view, right? That's how I understand it. Like, because for me, I was more like, when I didn't have this structure in my training, right? I was more like, okay, it's training time, go for it. It's kind of like, I took what I learned in dancing and all my 20 years of training, and taking lessons and attending camps and attending competitions and championships and all that. It's like, go for it, Now you got to perform. Go, So every time I run, I would boom, perform, right? It was effective, but it's taxing, like you say. So the next day I feel like, wow, I need to take a little break, rest. Wow, emotionally and mentally, it's more difficult, right? When you have this super taxing activity and now it's approaching, it's like, oh, this thing, oh my God, I don't want to do it, things like that. And then when I structure it more like a zone 2 run, right, which is low intensity, mentally and emotionally, it's much easier to approach it and execute it. And then when you do it for 1, 2, 3, 4, 5 weeks, not even running fast, you start to run faster, right? Because your body adapts. You're building the base. Your body adapts. It gets more efficient. It can sustain it, right? So I'm thinking, okay, so let's take that into dancing. So, yeah, sure, you need to last for high intensity 2-minute quick step, but maybe it's also beneficial to have like a very low intensity, maybe like a 4-minute quick step where you don't try so hard. It's just zone 2. You try to keep your heart rate as low as possible, jump as little as possible, and move as little as possible to train your body to have this efficiency in this movement, right? In this chain of events, right? And then throughout the time, it's going to actually make you stronger, faster, right?
Yeah.
Do you think that could work?
I think that could. The other consideration that maybe this is a topic for another day, but another consideration that people will have would be cross training. So maybe you keep your higher intensity days as rounds, and then you keep your lower intensity days as steady state cardiovascular exercise, or some like active stretching, or like a long walk, or anything that helps to still build up your physical capability and cardiovascular endurance, but does not have the negative ramifications of high intensity training. Yeah, and then training that you can do multiple days in a row, as opposed to rounds you just can't do multiple days in a row. It's just not possible. Like to do multiple rounds, high intensity for multiple days, I would certainly not recommend.
It's probably possible, but then you're going to crash.
Yeah.
Right? So then you're going to go below your baseline, and then you need to recover.
Yeah, and then the risk of injury, unfortunately, is quite a bit higher because you don't have the same like physical muscular performance and strength and endurance that you would normally have. Yeah, because you've pushed your body for too long over an extended period, for too high over an extended period of time.
I think, then the key takeaway would be, if you want to perform really well, it's sort of a long-term project, right? And this long-term project includes multiple facets in itself. Like teaching your body a certain movement, one, right? So that's just learning to do the move. And then it's this low-intensity training that you can do a lot for a long time. And then you kind of sprinkle in, okay, here's a high-intensity moment, and here's a high-intensity maybe 2 days, and then you go back to this, smoothen out. And then in the long run, you start to perform better and better and better and better, right? You can't approach this like, okay, I have this whatever once a week or twice a week thing, and I come and I do my high intensity thing, and then I leave.
Right.
Right? Which you don't have that huge base. You don't have that big base to build your huge dance house, right? You're having like a little bit here and a little bit there, and then you kind of try to make it work, right? Which is, it's possible, but it's not the best, right?
May not be the most efficient strategy.
Yeah, right. In the long run, right?
In the long run, yeah.
In the long run, it's better to be consistent and structured, right?
Yeah, and kind of progressively training your body over time, as opposed to kind of pushing as quickly and as hard as you can for maybe a short period of time, and then unfortunately, most likely burning out.
Yeah, burning out. Getting frustrated, right? You get frustrated. You really want to do a lot now, which is, I think it's a great, thing. I think it's,
because you're motivated.
Yeah, it shows me the passion of the student. He or she or they really want to do this thing, which is great. But we kind of need to step back and think about it. Okay, how are we gonna, make sure the highest chance of success in next month, in next 2 months, in next 3 months, and what are your goals,
Absolutely.
So, you don't want to harm yourself, right? Because, me being as a dance professional, I can tell you, okay, this is what's going to happen, and this is how it's going to progress, and you being a, expert in body and physical therapy, you can say, okay, don't do this, you get injured, or, just take it easy, you'll get there, but, it's just going to take a little more time. And it's going to ensure, it's kind of like an insurance policy, You buy this insurance policy to make sure your body is good, right?
Right.
Because if you dance, you don't want to dance just good this week, right? You want to dance and enjoy dancing for
Ideally,
next 5,
yes.
10, 15,
Yeah,
20, 30 years,
absolutely.
right?
Yeah.
You want to get healthier, you want to feel better, right? You don't want to, I think you don't want to have these crashing moments, right? You're really, really good, and then you stop dancing for 3 months.
Right.
Or it's really, really good, and then you go for vacation for 4 months.
Yeah.
Or you're really good, and then you got frustrated, and then
you
stop
don't
for a
want to
week
do
or
it.
2 weeks,
Yeah,
right? So
yeah.
then what happens, right? Your capability, your body memory deteriorates as you don't use it, and then you need to stop building up again, right? And you want to pick up where you were before, but you can't, right? Because again, you're risking a little too much. Why would you risk, right?
Yeah.
So you'd rather kind of take it slow, take your time, right?
Yeah, I think the gradual progression is really important. Yeah. And not just in reducing injury risk, but to learn any physical skill, it does take time, patience, and consistency. Absolutely.
Yeah.
Yeah.
I saw this video, whatever this guy was making this short quote. He said, it's not hard, it's just new.
Yeah.
You know, which makes total sense,
Yep.
you know, because for the professionals, it's not hard.
Yeah.
But because we did it for 20 years,
Yeah.
now it's not hard, you know.
Yeah.
And we invested so much aspects into it, you know, visualizing and learning and listening and
Right.
you know, making notes and watching videos and learning from other dancers and going to competitions and taking coaching, you know, and then doing cross training and doing stretching and resting and recovering, you know. And now 10, 15, 20 years later, now it's not hard anymore.
Yeah.
But you know, once you start, it's hard because it's new, right?
Yeah,
Not
absolutely.
necessarily maybe it's hard in itself, but it's because it's new to
It's
you,
unfamiliar.
right?
Yep.
For the body, it takes some time to adjust.
Yeah.
Makes sense, right?
Yeah. And maybe with that, we'll leave it for...
Yeah, cool. I think we had such a great conversation.
Yes.
It was nice to talk to you.
Yes, thank you for having me. I love talking about all things dancing and all things movement.
Cool. Yeah, and you know, we'll keep it up and see you next time.
That sounds great.
Okay.